Hello, this is our video project about Ceftriaxone medication. My name is Melvin Aferul Tobias.
My name is Yesi Rasika Sitoka.
My name is Liora Kalana. My name is Diana Frederica. My name is Silvania Kasma Putri.
Enjoy our video!
According to a comprehensive review by Sharma et al. 2024, ceftriaxone sodium is a broad-spectrum, third-generation cephalosporin antibiotic that was first synthesized by F. Hoffmann LaRouche in 1978. This drug offers key advantages, including strong resistance to beta-lactamase enzymes and a prolonged elimination half-life of approximately 8.8 hours, making it highly effective for once daily intravenous or intramuscular administration in treating various severe bacterial infections. Moving on, let's look at the distinction between the patent name and the generic name of this antibiotic. First, the patent name or brand name is Rozapin. This exclusive name was given by its original developer, F. Hoffmann LaRouche, as the innovator product that funded the massive initial research and clinical trials. Because it carries the official patent name, it utilizes a highly standardized manufacturing process and comes at a premium retail price. On the other hand, the official generic name is ceftriaxone sodium. The generic name represents the actual, standard chemical substance of the drug, free from commercial trademark restriction. These are formulated by independent manufacturers only after the original patent for Rozapin expires. Its key attribute is being extremely affordable, which significantly improves drug accessibility for the public. As a real-world example, we have attached the image of CEF3 manufactured by Dankos Pharma. According to a statistical study by Akhmetova and Zaksilikova in 2025, this difference in naming doesn't affect the drug's quality at all. Their research confirmed that there is no significant difference in antibacterial efficiency between the patent name formulation Rozapin and the generic name formulation CEF3. Both deliver the exact same clinical efficiency.
So today I will explain the group and classification of ceftriaxone. So ceftriaxone is a third generation of cephalosporin, a family of beta-lactam ring-containing small molecules that include the penicillin and exhibit the bactericidal activity against a range of gram-positive and gram-negative bacteria. So, as you can see, there's a five generation of cephalosporin. There's like a first generation, second generation to the fifth generation. So likely, as you see from the table, it's likely explaining that the first generation has good activity or an effective way against gram-negative bacteria. The second one generation has a similar activity to the first, and the third generation they have a less coverage against the positive bacteria and more against the negative gram bacteria. And the fourth and fifth generation are more gram negative to be correct to be coverage. So as you see that um, Ceftriaxone is more likely from the third generation, which is explain that the third generation is more have a more against the negative gram bacteria than against the positive gram positive bacteria.
Ceftriaxone can be used for patients who were exposed to suspectable infection due to gram-negative aerobic organism and some gram-positive organism. For example, patient who has serious lower respiratory tract infection, urinary tract, skin infection, gonococcal, intra-abdominal infection, septicemia, meningitis, bone joint infection, otitis media, and pelvic inflammatory disease. And then, ceftriaxone cannot be administered to a patient who are contraindicated with history of allergic reaction to penicillin. It can cause hypersensitivity reaction. Hypersensitivity reaction are the most frequent adverse event. For example, maculopapular rash that develops several days after the onset of treatment. The ceftriaxone should be discontinued immediately because of structural similarities between penicillin and cephalosporins. A few patients allergic to one type of drug may experience cross-reactivity with other. Neonate and infant should not be treated with ceftriaxone because it can cause displace of bilirubin from its binding to serum albumin, causing bilirubin encephalopathy. And also do not administer ceftriaxone with calcium-containing IV solution, including calcium-containing infusions such as parenteral nutrition, due to risk of precipitation between ceftriaxone and calcium.
So the next one, we are gonna talk about the side effects of the ceftriaxone drug. The first one, which is the allergic reaction such as anaphylaxis, which can be a life-threatening and it require immediate medical attention. Other side effects such as the itching, hives, hoarseness, shortness of breath, or any trouble breathing, also trouble in swallowing and swelling in your face, your hands or mouth after you receive this medicine, it should be reported to the doctor right away. And although it's less common than the other side effects, you may also experience diarrhea as well.
Okay, so I'm gonna explain about the pharmacodynamic. So, how's the Ceftriaxone act toward the body? Ceftriaxone actually acts by inhibiting the bacteria's cell wall synthesis, so it binds to the inner, activates the penicillin binding proteins, or so you call PBPs. So these penicillin binding proteins are likely it's like protein that are responsible for building and strengthening the bacteria wall. So the ceftriaxone it actually binds and deactivates the bacterial PBBs and shooting them down, leaving the bacteria structurally weak or unable to survive or to be replicated. Okay, so I will tell you about pharmacokinetic. It's a study of what body does to the drug. There's a four section. First is absorption, distribution, metabolism, and last elimination. So, absorption is Ceftriaxone usually administered parenterally via intravenous injection or intramuscular injection. Next is distribution. Ceftriaxone is widely distributed into various body fluids and tissues, reaching the gallbladder, lungs, bone, including the cerebrospinal fluid or TCF, particularly in the presence of inflamed meninges. And the third is there's a metabolism. Ceftriaxone undergoes minimal metabolism in the liver. Most of the drug remains unchanged in the body, meaning it is not extensively broken down before elimination. And last is the elimination. Usually, ceftriaxone is mainly eliminated through the kidneys via urine for about range 33 to 67%, and the remaining portion is excreted through the bile and the feces in an activate form and in range about 35 to 45%. It has a relatively long elimination half-life of about 5.8 to 8.7 hours, allowing it to maintain its effect in the body for an extended period.
Because cephalosporins or the ceftriaxone are poorly absorbed by the GI tract, because of the structure of ceftriaxone is highly unstable in acidic environment, and that means the drug is rapidly degraded and destroyed by the gastric acidity. Like it's losing its biological efficacy before entering the intestine. Many cephalosporin medication, for example ceftriaxone, are administered through parenterally or through injection, for example intravenous and intramuscular. The recommended dose for adult is through IV with a dose of 1 and 2 grams daily with maximum dose of 4 grams every 12 and 24 hours. For children, administered through IV with the dose of 50 to 75 milligrams per kilo per day in equal dose every 12 and 24 hours. And this is the source of the dose.
Now we will talk about nursing consideration. The first one, in the nursing consideration section, nurses review the patient's history of allergies to ceftriaxone, cephalosporins, and penicillin before administering the medication. This is important to prevent hypersensitivity reactions such as rash, itching, shortness of breath, or even anaphylaxis. Next one is we enter to the number 2 and number 3. Furthermore, if possible, cultures and sensitivity tests should be performed before therapy begins to ensure the antibiotic administered is appropriate for the cause of the infection. During treatment, nurses must also monitor complete blood counts or CBC, kidney function, and liver function to assess the patient's response and detect side effects. Next, number 4, 5, 6, and 7. Nurses should also monitor for side effects such as diarrhea, nausea, vomiting, and irritation at the injection site. For intramuscular administration, ceftriaxone must be injected to alert muscle, and the injection site should be rotated if administration is repeated. For intravenous administration, the medication is administered slowly according to protocol. The last list is number 8 and number 9. Additionally, patients should be educated to complete the full course of antibiotics even if symptoms have improved. Patients should also report immediately if they experience severe diarrhea, a rash, or difficulty breathing. So we can see here some nursing consideration before administering the medication. We have 9 nursing consideration. You can read from these slides.
So we're gonna move on to the pregnancy safety of the ceftriaxone drugs. The first one, the ceftriaxone drug is classified as a pregnancy category B, which means the animal studies shows no risk or the animal shows risk unconfirmed in humans. The next one, the animal studies has shown no fetal harm and available human data have not demonstrated an increase of congenital abnormalities. The ceftriaxone may be used when it's clinically indicated, and it's generally considered safe during pregnancy, especially when it is prescribed by the healthcare provider, but it should only be used only when under medical supervision. So the ceftriaxone is commonly used during pregnancy to treat serious bacterial infections such as the urinary tract infections, pyelonephritis or the kidney infections, pneumonia, gonorrhea, and other moderate to severe bacterial infections. And also, the ceftriaxone's effects on the breastfed infants and milk production are not well established. So the last one, we're gonna talk about the special precautions of the ceftriaxone drug. The first one, we have to use it carefully in patient with a history allergy to cephalosporins, penicillins, or other beta-lactam antibiotics due to the risk of cross-hypersensitive reactions. And then the second one, we have to use it cautiously in patients with severe kidney or liver impairment. The third one, we should not mix or administer it simultaneously with calcium containing IV solution in neonates due to risk of precipitations. And the last one, we have to use it cautiously in neonates, especially premature infants or those with hyperbilirubinemia. Okay, so here's the references that we use on the project.
So that's the material that we shared. We hope it can be useful.
Thank
Thank
you.
you for watching.